What we're hearing from doctors all over the country, it's not just in London and the southeast anymore, is that services are extremely stressed, very much under pressure. We are hearing about people being treated in ambulances in car parks outside the hospital because there's no room inside to bring people in. We're hearing about surge plans being activated, which is where intensive care and respiratory wards surge into other wards where they wouldn't normally be to take over the space because they have too many patients to fit in where they're supposed to be. We're hearing about major incidents being declared, staff being redeployed from other services to look after intensive care and respiratory patients with COVID. It's getting to the point where we are struggling to maintain basic standards in some hospitals. We've got sickness rates somewhere between 8 and 12%. We've got staff going off sick with COVID, whole teams sometimes having to isolate when there's been a cross-contamination issue. We've got to vaccinate everybody as soon as possible, ideally within the next couple of weeks. We've got to prioritise vaccines for healthcare workers. Otherwise, the NHS could well collapse because individual services are reliant on such thin numbers of staff that it's only going to take one or two more people to go off sick in a service for that service to fall over. And then potentially that could lead to a hospital having to turn patients away and send them to another hospital elsewhere. And that's not going to be sustainable. The priority for the country has to be to prioritise healthcare workers to get the vaccine first. It's the old thing of, put the oxygen mask on yourself before you help others. We've got to keep the NHS running. Otherwise, we're not going to be able to help the other people in other categories who are currently category 1 for the priority vaccine rollout. We need to make sure that healthcare workers are protected so that the NHS can continue looking after everybody. What I want to say to people who are watching this is that they have to take this seriously, that the pandemic is real, the hospitals are filling up, people are being treated in car parks, and the restrictions that we're under, the imposition on all our lives is incredibly demoralizing, but it's even more demoralizing being in hospital and looking after people who are breathless and scared and terrified and having to take them to intensive care and then going home on the train and seeing people sitting around without masks on and not taking it seriously. We've really got to get on top of this. We've got to vaccinate people. We've got to socially distance. We've got to stay at home wherever possible. This is absolutely a key period for the NHS. The next couple of weeks is going to be crucial to whether the NHS continues to be there for us or whether it falls over.